Good morning, everyone. Thank you so much for joining us this morning. My name is Tiffany Narvaez, and I am part of the marketing team here at United Ag. Thank you for joining us. This is Health Chats, and today's topic is heart health. Before we get started, just a couple of housekeeping rules. Please make sure that you remain muted. I will try to mute you all as you come in, but be sure not to unmute yourselves. Feel free to chat in your questions and we'll try to get to all of those at the end of the webinar. If we don't have time to get to all of them, we will answer them and send those via email. So before we get started, we've been having some technical difficulties, so please chat in if you cannot hear me. So I think you guys can hear me, so I'm going to keep going. Here with us today is Dr. Rosemary Koo, but before we get started, I want to thank all of our sponsors who make this possible. Thank you to our program sponsors, CVS Caremark, Elite Medical, HCP National, Plantel, and Sain. They're part of the reason we have Health Chats. So today we have Dr. Rosemary Koo, who is our Chief Medical Officer here at United Ag. And Rosemary, you can take it from here.
Great. Thank you so much, Tiffany. I'm very excited to talk today about cardiovascular health. And yes, please bear with us as we do have some technical difficulties here. Okay, so you should be able to see the topics I'm covering today. We're going to start off by talking about trends in heart health. We'll also talk about cardiovascular warning signs that you don't want to miss in case you're having symptoms. We'll go over nutritional updates for cardiovascular health prevention. And additionally, we'll talk about lifestyle recommendations. And then lastly, we'll close with the United Ag resources that we have available to you. And then we'll leave about 10 minutes at the end for question and answers. Great, so let's just jump right in. So unfortunately, cardiovascular disease is still the leading cause of death worldwide. And this is for both men and women and almost also across all ethnic and racial groups as well. In the US, actually, one person dies every 37 seconds from cardiovascular disease. And even though the death rate of cardiovascular disease has actually gone down over the decades, the kind of disconcerting fact is that more of the disease is actually showing up in younger people. And in fact, 1 out of 3 heart attacks are in people under 55. And there have been studies done on what are those factors that lead to young people having heart attacks. And of that group under age 55, 3/4 of them have high blood pressure, about 1/3 have diabetes, and half of them smoke. As you can see that these are all factors that can be modified, and in fact, 1 out of 4 cardiovascular deaths are preventable. One of the most common forms of cardiovascular disease is coronary artery disease, and about 80% of cardiovascular disease is actually due to lifestyle modification. So it's really important to recognize that this actually shouldn't be happening. That so many people are still dying from cardiovascular disease because it's entirely preventable. When most people think of coronary disease, they think of plaques within the arteries that supply blood to the heart. And they often in their heads will visualize these plaques getting larger and that causing a restriction of the blood flow to the heart muscle itself. But what people often forget, and also what the scientific community is understanding over time, is that plaque usually starts with inflammation. And in fact, before that plaque starts kind of hardening the arteries, there's something happening in the vessel walls where the elevated blood fats kind of get into the blood vessel walls. They cause inflammation, and over time they cause the occlusion. And if those plaques break, that can cause an acute heart attack because a lot of the inflammatory cells and platelets kind of go around those plaques, and then it basically strangulates the heart muscle from getting good blood flow. And I want to emphasize the inflammatory part of this as kind of the root cause of coronary disease, because that's where all the focus is for preventing cardiovascular disease. How do we bring down that inflammation or prevent markers of that inflammation from causing disease? Before we go into that, though, I do want to highlight some cardiovascular warning signs, because if someone does have a heart attack, time is of the essence. As time goes on and the heart muscle is not getting appropriate blood flow, that heart muscle dies. And then if enough of the heart muscle dies, then that can lead to heart failure because the heart is just not able to work as well over time. Also, 14% of people who actually have a heart attack will die. And so getting to the doctor in the emergency room right away is critically important. And unfortunately, 1 out of 5 heart attacks are silent, though, but there are kind of warning signs that could lead to earlier diagnosis of a cardiovascular event. The first is having any symptoms while you're doing physical activity. Now, the classic kind of heart attack symptom that most people think of is kind of crushing chest pain, like an elephant sitting on your chest. And while that is certainly indicative of a potential heart issue, that's not the only sign. And if you have even nausea or lightheadedness, any arm pain, or back pain while you're doing physical activity. And that could be as simple as walking upstairs or walking up a hill, and you've noticed that those kind of symptoms come on during physical activity, but then go away when you rest. Those are signs that you definitely have to talk to your doctor about. And that goes for shortness of breath with any daily activities. If you feel that you are getting more deconditioned over time, it might not be because you haven't been physically active for a while. It could actually be your heart. Lightheadedness is also a sign of heart issues, potentially even arrhythmias or abnormal heart rhythms. Leg swelling and trouble lying flat are often symptoms that people ignore. And these could be symptoms of heart failure because heart failure causes fluid to build up in the body. And so if you have leg swelling, that could be that buildup of fluid. And if you have trouble lying flat, that could be because there's fluid building up in the lungs. I actually had a patient come in, this was a few years ago in urgent care, who had complained about these two symptoms. And she was probably in her early 40s, female. And she said, I've gone to my doctor a few weeks ago. I've been having these symptoms, and he thought I was deconditioned and just gave me compression stockings to help deal with the leg swelling. Well, it turned out she had actually had a silent heart attack, probably either weeks or up to 1 or 2 months prior by her EKG. So they show signs of an old heart attack. And her heart was basically working about half as well as it normally did. So she was actually in heart failure, but the signs went unnoticed for, unfortunately, too long. And then fainting and palpitations are other things that you should definitely talk to your doctor about. A lot of people I've seen in urgent care will say, I just fainted. I was probably dehydrated. And they have to get a cardiovascular workup. And yes, it could be dehydration, or maybe they were maybe they had like sight of blood, or they were going through a very stressful situation. But it's always important to have symptoms like this get checked out. Also, I see a lot of people kind of get confused with the symptoms between a heart issue versus anxiety versus reflux. So the symptoms for all three of those conditions can be very similar. In fact, when I was in residency, one of our chief residents brought herself to the emergency room because she thought she was having a heart attack when it was actually just really bad acid reflux. And usually kind of differentiator in some of this, especially between a heart issue and anxiety, is the duration of time of the symptoms. So any kind of chest symptom that's kind of on the order of seconds or less than a minute is most likely not the heart. And also similarly, if the symptoms kind of go on for days and is fairly constant, it's most likely also not the heart. But I always recommend like just go to the doctor, get checked if you're not sure if anything new is happening in your body. And it's also very important to mention family history, because even if you don't have kind of the classic symptoms of a heart attack or heart disease, if you tell your doctor that you have a very strong family history of heart disease, it completely changes the way we think about your level of risk. So always mention that. Um, and here, let me segue into what people should be doing to make sure that they maintain good heart health. And the first is to get your annual physical exam. Now, I stressed early on that cardiovascular disease is mostly preventable. But in order to prevent it, you have to know your risk factors. And so you have to know if you have any risk of diabetes or prediabetes, hypertension, or abnormal cholesterol levels. Once you know that, you can control those risk factors, and that'll greatly reduce your risk of cardiovascular disease and stroke down the road. I do want to mention here that there are some people with a strong family history of heart disease, but actually have normal blood work. And by blood work, I'm kind of referring specifically to the LDL cholesterol, which is thought of as the quote unquote bad cholesterol. And it's a little bit confusing when people say, well, my numbers look good. But yeah, I know that a lot of men in my family or women in my family have died from heart disease. And that's a sign that you might need advanced lipid testing, because the LDL-C measure that's in the standard lipid panel only looks at your total cholesterol in the LDL particles, but it actually doesn't differentiate how many particles you have and if they're small or big. And the reason why this is important is because big LDL particles are actually not that dangerous. They're kind of big and fluffy, and they can't really cause damage to your blood vessel walls. But the very small particles are the ones that are very dangerous, and they're very inflammatory, and they work themselves into the blood vessel walls and cause a lot of inflammation and plaque formation. And now two people could have the same LDL C measure, but if you do advanced lipid testing, one person could have a very low particle count, and some person could have a very high particle count, and the high particle count is more dangerous. The reason why the scientific community will sometimes do this advanced testing is because we've realized that a lot of people, when they present with their first heart attack, often have normal standard blood markers. So this is why if you have a very high risk in your family, you might want to talk to your doctor about whether or not you should get more detailed testing there. And then also for the clinicians who might be here, if someone does have a high particle count, that's usually either attributed from one, largely genetics, or second, due to insulin resistance. And so if someone, you know, wants to kind of modify their lifestyle, kind of using any of the lifestyle measures like lower the carb intake for combating insulin resistance will often bring the particle count down. And then I do want to talk about medications here. You know, statins and aspirin are really critical medications if you do have risks for heart disease. A lot of people kind of feel like they're optional, especially the aspirin, but these are very important. So talk to your doctor about whether you need any of them, and make sure that you do take them if your doctor does say that you have to. If you're having side effects from them, discuss that with your doctor, because they might be able to change it to different formulations that might be better. And then lastly, if you do have signs or risks of heart disease, additional tests that you might be ordered include an EKG, you might get an echo, which is an ultrasound of the heart. You could get various types of stress tests to monitor how your heart does when you're doing physical activity. Or if you have a lot of risk factors for heart disease, they might actually have you do basically what's kind of considered an elective catheterization. So they would actually look at the blood vessels of the heart to see if there are any occlusions, and then possibly stent them if they do find them. And although that might seem like a scary process, it's actually much better to be proactive and do that instead of finding out you do have an occlusion by having an acute heart attack. Okay, so I do want to jump into nutritional updates. There's a lot of controversy over what's considered a healthy diet over the last several years. And the first is around total fat, saturated fat, and cholesterol. The fat has just generally been demonized in the nutritional guidelines, both by the American Heart Association and the American Diabetes Association over time. But finally, they're starting to kind of change their tune about it. Over down here in the right corner, you can see a quote from the US Dietary Guidelines Committee, and they talk about fat not really being that high of a concern anymore. And in fact, reducing saturated fat or total fat doesn't reduce the risk of cardiovascular disease. And then the dietary cholesterol that you eat in your food doesn't actually equate to the cholesterol in your blood. I know that might seem counterintuitive, but that's not actually how the body works. And so, total fat, saturated fat, and cholesterol are not as bad as what we thought they were before. However, most experts will agree that trans fats are bad, so you should absolutely avoid trans fats at all costs if you can. They're usually called out pretty clearly on nutritional labels. And also a lot of fried foods, if you go out to eat, will actually have trans fats in them. So avoid fried foods for that reason. And over time, even though we are more tolerant of fats, we're actually less tolerant of sugar and carbohydrates. And most experts now will finally agree that sugar and refined carbohydrates are much worse for your metabolism and cardiovascular risk than fat is. And sodium is a topic that can get pretty confusing. A lot of the cardiovascular diets recommend low sodium diets. And I do want to preface that, so sodium is more dangerous for people who have high blood pressure or known heart failure than it is for the general population. People who are healthy, meaning they don't have any chronic conditions and not any kidney issues or high blood pressure issues, if they eat a little bit more salt in their diet, they will usually just excrete it out in the urine. And it doesn't necessarily lead to high blood pressure. But the sodium levels I'm talking about are eating sodium from the food that you're cooking yourself. Sodium in processed foods is much higher, so that's a different story. And I do recommend limiting all processed foods for the sodium and for the carbohydrates in them. But if you're just generally mostly cooking yourself, the salt that you use is fine. But if you do have high blood pressure or heart failure or kidney issues, any little increase in sodium in your diet would cause a lot of water retention. And so you do want to be very careful about sodium in those situations. And then lastly, a lot of supplements have gained popularity recently. So I do want to touch upon omega-3s, vitamin E, and coenzyme Q10. So omega-3 fatty acids are anti-inflammatory. And the American Heart Association doesn't generally recommend them for people who are healthy. So it's not thought of as a supplement that everyone needs to prevent heart disease. But for those with very high triglycerides or those with known coronary artery disease or heart failure, they actually do recommend getting extra omega-3s, either in the form of eating more fish or even supplements if necessary. As far as other vitamins like vitamin E, A, or vitamin C, a lot of people like to take these antioxidants, but there's pretty much inconclusive evidence as to their benefit. So the American Heart Association will just say that, you should get these nutrients from food instead of taking supplements, because there is a possibility of overdose in them. And then there's a lot of controversy around coenzyme Q10. And I've heard some people, really get benefit from it, especially if they're on a statin and it helps with their muscle function, but it's not generally recommended. Okay, and then I do want to touch upon some general lifestyle recommendations as well. And I'm actually going to wrap up pretty quickly after this. And so the three areas I do want to stress here are alcohol, obstructive sleep apnea screening, and stress management. So alcohol both indirectly and directly affects heart health. So indirectly, it causes a lot of inflammation and can increase the dangerous blood fats. So like the triglycerides can increase if you drink too much alcohol. And it can also directly harm the heart tissue itself and cause arrhythmias. So there's a kind of a medical syndrome called holiday heart, where we will actually see more people come in after the holidays or like or big events into the ER with palpitations or even atrial fibrillation that they never knew they had before because they drank too much, and then that triggered their heart issues. Obstructive sleep apnea is a condition where you basically stop breathing multiple times a night. This decreases oxygen flow to your brain and actually puts a lot of pressure on the heart and lungs. I've actually seen people land in the ICU because of long-term having this condition and not having it treated properly. So if you snore, or you're tired all the time during the day, even though you've slept at least 7 to 9 hours, you have to talk to your doctor about getting screened for sleep apnea. And lastly, stress causes insulin resistance, which is very inflammatory. And there are even in some states, firefighters, because they're under so much stress, that if they have a heart attack, even if they're off work hours, it's considered workers' comp. So that's just an example to show you how important stress management is for cardiovascular health. And then lastly, I know I stressed before that you should get your annual physical exam. We are very fortunate to have our health and wellness centers. So you have access to them to go get your annual physical, go back for checkups. And if you do have any risk factors for cardiovascular disease, we have a very thorough intensive lifestyle change program to get you back to good health. And you also have teledoc if you have any acute symptoms after hours and you need to talk to someone right away. They can help you get to the appropriate care. So I'm going to hand it back over to Tiffany. Thank you. I know that was a lot of content, and then we'll leave some questions for the end. But first, I'm going to hand it back over to Tiffany.
Thank you so much, Rosemary. And again, thank you to all of you for bearing with us during all of that technical difficulties. I do want to remind you all that beginning this month, Health Chats will also be offered in Spanish. And the very first episode, if you will, is on Tuesday the 25th at 3 o'clock, Charlas Saludables Corazón Sano, and that'll be hosted by Carmen Bravo, who is a registered dietitian at our health and wellness centers. So don't miss that. We highly encourage you and your staff to tune in. And we will send a survey in the next couple of days to get your feedback on the timing of this and the Spanish language webinar. So I don't see that we have any questions. So if anyone has any questions, please chat them in right now. I'm not seeing anything. So Rosemary, I think we're good. Thank you all for joining us.
Thank you.
And have a happy Friday. And oh, no, they're coming in. Any benefits with omega-9?
That's a really good question. Right now, I think the scientific community is waiting for more evidence to generate on omega-9. So mostly the recommendations are all around omega-3s, specifically EPA and DHA.
Thanks, Rosemary. Anyone else? That was a great question. All right, well, if you have any other questions, I have seen that very low sodium can also be harmful. Any thoughts?
Yeah, that's actually a good point, is that if you kind of specifically don't have enough sodium, or you drink a lot of water to try to flush out your sodium. And if you accidentally bring your sodium levels too low, that can actually cause a lot of issues and even seizures. And so that's why I kind of try to counter is that if you're generally healthy and you don't have any cardiovascular risk factors, you don't have to really monitor sodium as closely, other than just trying to avoid processed foods. And it's only for those specific conditions of heart disease and heart failure and high blood pressure and kidney disease that you really have to watch it more closely.
Great questions. Keep them coming. Can patients request lipid particle testing, or is that up to the doctor?
Yeah, that's a great question. I'm actually not sure how the health and wellness centers will handle this, and I'm sure they can. I mean, they can refer out to almost any type of lab test. So if you, okay, it's best to actually be an informed consumer in this case, because most providers won't automatically think about LDL particles. It's not actually something I learned about in medical school, and even cardiologists that I've talked to sometimes aren't fully aware of why it might be important. So if you do have a strong family history of heart disease, but all your labs look normal, then it's actually important that you ask your doctor about whether or not you need the advanced lipid testing, including particle testing.
Good questions, everyone. Keep them coming. We have a couple more minutes, so. How do you feel about individuals who decide to self-medicate with a baby aspirin as a preventative measure? That's a good one.
That is a good one. Um, so that if someone doesn't actually need aspirin, like they're generally healthy and they don't have any risk factors, the side effects can outweigh the benefits. So for a lot of people, taking aspirin does bother the stomach lining. It increases risk of bleeding, and also bleeding from the stomach. And so we don't generally recommend that people take it unless they need it. But if they don't have a high risk of bleeding, and they can tolerate from a GI standpoint, then the risks are fairly low otherwise.
Do triglycerides increase the risk of coronary artery disease?
Yes. And I think we're still trying to understand the full effects of this, but absolutely triglycerides do increase risk of coronary artery disease. And one aspect is that triglycerides are a marker of insulin resistance. When someone has insulin resistance, their triglycerides tend to be much higher. And so it might just be kind of an additional marker of an underlying condition. But also when people have very high triglycerides into the few hundreds, that could be quite inflammatory as well. So most likely there are multiple ways in which triglycerides are bad for heart health, but we're still trying to understand all of those connections.
Great questions. We have a minute left, so if anyone else wants to chime in, again, if we don't get to your questions, they will still be answered and sent to everyone via email. So, anyone else? Thank you so much, Dr. Rosemary. Oh, they're coming. Are high triglycerides related to diet only, or is that genetic as well?
Both. So if triglycerides are kind of mildly elevated, I would say probably um, like kind of less than the 200, like 150 to 200, or even up to 300. If it's mildly elevated, it's most likely just related to diet. If it's any higher than 2 to 300s, I've seen them up to 600s and beyond. That's most likely genetic. And then the dietary issues that cause high triglycerides are actually the high triglycerides are caused by high carbohydrate and high sugar diets, and not necessarily high fat diets.
All right. Thank you so much. If you have any additional questions, please email them to membership@unitedag.org and Dr. Rosemary will answer those. Thank you so much to everyone. Thank you, Dr. Rosemary. You always enlighten us. And tune in to Corazon Sano on Tuesday and have a great Friday, everyone.